Hey, Coach. Just wanted to show you a couple of exercises that Charles worked on with the physical therapist this morning. Okay, so I have a pretend 10-pound kettlebell. And so these exercises are to help an imbalance Charles has in his back. He's developed much stronger muscles on one side of his body to take those shots, and the opposite side of his body is weaker, and so he's getting pain because there's some pulling happening and in the rotation. So the first exercise that they did today was, assuming this is a 10-pound kettlebell, we're just going to do some side flexion, making sure that the shoulders and the hips stay square, so we're not rotating in this exercise. And then we'll do the other side. So pretty straightforward there. The second exercise is kind of a wood chop exercise. So we would take the strap in the outside hand, and opposite hand is going to go over, and our feet are just slightly wider than the hips, and you're just going to rotate down and bring it back. So the strap, or in this case I have a spring, it's set higher above the shoulder, and you're just rotating the upper body, keeping the hips completely still, and maybe even drawing the tailbone down and belly button back a little bit to deepen the core muscle engagement. And then we would do that on both, the other side as well. And then the last exercise they worked on today is rotation, unilateral chest press with rotation. So the body weight is in the back leg and the opposite arm is out in front. And so it's rotating the trunk through, keeping the hips facing forward, and then with control, bringing it back. And driving the exercise from the core and rotating from the rib cage up, right? So it's the obliques. Using the breath to do that rotation. And then of course, you're just trying to keep your hips facing front and only move from the waist up. So those were the 3 exercises that they worked on this morning, and I was just hoping you could maybe work those into whatever weight training work you're doing with Charles in the weight room. Thanks.